Welcome to the Gut Show. I'm Erin Judge, registered dietitian and founder of Gutdirected, and I will be your host. My goal on this side of the internet is to empower those with IBS and digestive disorders to understand their guts better, to have a healthier relationship with their bodies, and make confident choices to improve their digestive health. During this season of the Gut Show, you can expect a weekly conversation covering a hot topic related to health, digestion, and IBS. As a disclaimer, I am a dietitian, but I'm not your personal dietitian. Everything we cover in this episode is meant to be educational and not a substitute for personalized care from your healthcare team. Welcome, and let's dive into today's episode. What if you could develop the skills to manage intrusive IBS symptoms in 10 minutes a day or less? Mahana IBS is the first FDA-cleared digital therapeutic that is making gut-directed cognitive behavioral therapy accessible to everyone who needs it. Discover the connection between your brain, gut, and behaviors, and develop new skills to reduce the impact of IBS with Mahana. This is proven to reduce the severity of IBS symptoms. Learn more about Mahana IBS and view their provider finder at mahana.com. That's MAHANA.com. Since Mahana IBS is an effective, proven, and personal digital treatment that is FDA cleared, it is currently only available by prescription from healthcare providers as part of your treatment plan. So talk to your doctor or find a provider through the provider finder today. Did you know that gut-brain therapies have been shown to be effective treatment options for IBS? Maybe you've been told to try a gut-brain therapy, but you're not really sure how they work. If that is you, or this is new information for you, then today's episode will hopefully shed a little bit of light on what these gut-brain therapies actually are and how they can improve IBS symptoms and how to figure out what the best option for you actually will be, because they're not all created equal and they don't just work by accident. They do need to be intentionally used in order to be effective. So the connection between gut-brain therapies and IBS really starts with the gut-brain connection. This is also often referred to as the HPA axis, which is where this communication and connection point actually happens. But the gut-brain connection is the bidirectional communication between the gut and the brain. This is where hormones are activated to control metabolism and hunger, as well as neurotransmitters that communicate the body's needs and what actions that organs need to take, including those that are needed for digestion. This communication pathway is also a communication between the central nervous system and what we call the enteric nervous system, or the ENS. The ENS is actually located in the GI tract and is termed the second brain because it closely resembles the central nervous system, or the CNS, that's kind of connected and isolated more in the brain. Now, the CNS is the major command center of your body. It's where your brain is able to communicate to the body and have things communicated back to it so it can determine what needs to happen. So think about it as the major command center that's keeping everything running smoothly. The ENS is like that, but inside the gut. And so its major role includes digestive motility and blood flow, and even digestive secretions through the digestion process in order to digest, absorb, and utilize foods properly. Now, the ENS and the CNS can actually work together whenever this communication pathway is strong, healthy, and working as it should, but they can also work independently of one another and could kind of sabotage each other a bit. I like to think about this like the Kardashian sisters, where whenever they're working as a team, they're unstoppable and they get things done, right? But whenever they want to sabotage each other in fights, they do it just like any other sisters out there. And that can lead to a lot of drama, a lot of mess that needs to be cleaned up, and just a lot of stuff that you really don't want to deal with or that wasn't ideal to begin with, right? That is what can happen with the gut-brain connection and this communication pathway, especially in IBS. So in those with IBS, we know that the communication pathway is altered, likely due to dysbiosis in the microbiome and the role of microbes, but also other unknown factors. We've been able to see that this is true because we know that those with IBS, whenever they're taking in sensations through the digestive system, the pain responsive regions in their brain are activated, which leads to pain. And that is what we call hypersensitivity with IBS. That's the best mechanism we've been able to fully identify in terms of this altered communication pathway. But there's a lot else to explore here. We do know that there's likely something going on with neurotransmitters, nerves, the pathways in the brain that can be altered from stress, that can also be altered from maybe even genetics or infection or some sort of kind of trauma of some sort to the body. But we also know that gut microbes play a role, which can be altered from diet and lifestyle behaviors, early childhood feeding, lifestyle like antibiotic use, but also infection. So there's a lot that can be going on in those IBS that might contribute to this altered connection. But we don't fully know exactly what it is specifically, which means there's not a lot of treatments that target that mechanism to cure the connection as of now. What we do focus on is how the gut and the brain are responding to one another. So we do believe that the gut mirrors what is going on in the brain because of this connection. We also know that stress can increase intestinal permeability and inhibit the vagus nerve, which also runs along that HPA axis and is involved in this communication pathway. This can negatively affect the function of the gut as well as that composition of gut bacteria, leading to more unfavorable bacteria and dysbiosis. We know that long-term stress can also trigger low-grade inflammation, which can then mess with the gut microbiota and intestinal permeability even more, leading to more of that leakiness in the gut that we see in those with IBS. And then with IBS, we know that there's already this kind of heightened sensitivity to sensations because of the focus of symptoms, because you're living with symptoms, right? So you're thinking about them and you're experiencing them day after day after day, as the chronic nature of IBS, forces you to. And that hypersensitivity is even more severe and persistent because of the gut-brain connection, which is related to that pain responsive part of the brain that is now triggering pain as part of this sensitivity and this focus on symptoms and the feeling of symptoms, which can make you feel even worse and bring even more stress and anxiety and worry into the picture. So whenever we are thinking about gut-brain therapies, these are in place to help target this gut-brain connection. The exact mechanisms for these treatments and the response that we see and even the research available is not known, but beneficial outcomes have been really well documented in thorough, well-designed studies. So these are truly evidence-based treatments that are shown to be effective because they help target this connection. What they're likely doing in some way is sort of toning down the conversation. So instead of the gut and the brain yelling at each other and over communicating, leading to kind of disruption on both ends, if we can tone down that pathway a bit, then we're able to kind of tone down those reactions, which leads to less pain, less change in motility and gut function and things like that. So there may be a role of just stress management involved in these therapies, but it's likely a lot deeper than just a kind of visceral, like, okay, let me decrease my stress. There's probably some sort of deeper gut brain calmness or toning that is happening to help calm the nervous system, but also calm what is going on with this communication pathway. And that's why they can be so effective. So when we're considering utilizing a gut brain therapy, we have to look for signs of this altered communication pathway. This may look like stress, and it may look like a clear symptom response to stress. That is one thing that may clearly show you that a gut-brain therapy can be helpful. What we also may look for is hyperreactivity. So if you are feeling just very focused on your symptoms, where it feels like everything that you feel in your body is heightened, it's controlling every part of your day, and everything that you do is really based around your symptoms, that's a sign that there might be a high level of reactivity and sensitivity to what is going on in your body, which may be partly related to this gut-brain connection and the heightened kind of connection that's happening between the two. So a gut-brain therapy may be able to help with that. Did you know that you can access evidence-based gut-directed CBT from your phone or tablet. Mahana IBS is a digital therapeutic developed by gastroenterology and psychology specialists that teaches you the skills to manage IBS and decrease symptom severity in as little as 10 minutes per day. A clinical trial showed that nearly 2 out of 3 patients that used Mahana IBS reported improvement in their IBS symptom severity, which means you can have access to tools to self-manage symptoms and develop strategies to live a fuller life with IBS. Mahana IBS works by utilizing the gut-brain treatment of cognitive behavioral therapy, or CBT. This helps you shift habits, thinking patterns, and emotional responses in order to reduce the impact of stress on your gut. Learn more about Mahana IBS and view their provider finder today at mahana.com. That's MAHANA.com. Since Mahana IBS is an effective, proven, personal digital treatment that has been FDA cleared, it is currently only available by prescription from healthcare providers as part of a treatment plan. Talk to your doctor or find a provider today through the provider finder. Now back to today's episode. And then another one would be feeling like you're stuck in self-sabotage cycles, or kind of that working against yourself panic mode. So not only are you feeling everything and really hyper fixated on everything that's going on in your body, but now you're creating like these sabotaging behaviors as a way to not necessarily self-harm, but almost kind of preserve some of your feeling of control. So the feeling of, well, I'm gonna have symptoms anyway, I might as well do this. Or you, let's say, don't eat at all day, even though you know that food maybe wasn't triggering the symptom, but you are kind of reactive to it in that way, right? So you have reactivity. Or you cancel all plans, at all times because of your symptoms, or even just the fear of symptoms. That could be an example. But you have these kind of self-sabotaging, reactivity type of behaviors in place, which may not be a direct link to the gut-brain connection, but maybe an indirect link to that hyperfixation, the pain, that visceral sensation that you're feeling, and then also the heightened kind of anxiety and stress that comes along with this connection. Because not only can stress impact your gut, but having chronic symptoms and living with a chronic condition, especially one where you may not know what's actually going on, leading to, a lot of worry and a lot of frustration and, feeling gaslit, feeling confused about what you're actually experiencing, that can cause stress and anxiety as well. And then you put in the fear of the worst symptoms you've ever had coming back, which is almost like a trauma response, that can heighten more of that stress and anxiety, which wasn't necessarily your fault or your choice to have, but now it's present. And then the reactions that come out of that can be very much reactive and self-sabotaging in order, again, to regain some sort of control or even just feel any type of a short-term comfort, right? That might be what you're going towards, even subconsciously. So if you notice these things in your life, then that could be a sign that a gut-brain therapy can be really effective for you. In my practice as a dietitian, I also see that patients who are dealing with a lot of fear and hesitation in taking next steps, whether that be doing FODMAP challenges or adding in more movement or building up their fiber intake or trying a new medication or a supplement that's recommended by their healthcare team or even seeing a new specialist, there's a lot of kind of fear and stress around that because of past experiences. Gut-brain therapies can also be really effective. And I see it supportive really of a lot of my patients that are just struggling day to day with their symptoms and they want to use every tool available. You may not have these clear, obvious, loud signs of gut-brain communication, being part of your symptom picture, but there may be, still a link there and a benefit that you can see as part of your holistic treatment plan. So there's a lot of room for these therapies in IBS treatment and in your IBS journey, wherever you may be currently. So now I want to go through the different therapies that are out there that you've probably heard of and maybe their app forms so that you can better understand what they are and then know how they might work or not for you, and just have even tools that you can communicate with your healthcare team to figure out what the next steps would be for you. And then we'll talk about some resources that are available if you're interested in giving these a try. So the first type of gut-brain therapy is called cognitive behavioral therapy, or CBT. CBT is a broad range of therapies that is used to kind of challenge thought patterns and to influence behaviors. And so it's really targeting how you respond to stimuli and how you're thinking about your condition and responding to that itself, or thinking about your day. This is used a lot for anxiety. It's used for a lot of different conditions. So we're looking for gut directed CBT, so specifically to the gut, which has been studied. And when it comes to IBS, this can help reframe beliefs about IBS and about your condition, identify patterns of thinking and the action working against them, and then build in more effective coping strategies to improve your quality of life. So that's the goal. I consider CBT to be a little bit more tangible and hands-on and more action-oriented. So it's definitely an active therapy where it's not just you're listening and trying to absorb and take in like a meditation. Like that might be a little part of it, but it definitely has more of an action step to it. So if you are an action-oriented person and you're like, okay, I just need to be told what to do, or I need to take a step, then CBT can be really effective for that, which is what I love about it as a practitioner. In studies, CBT has been shown to improve IBS symptoms, including pain, and then quality of life for IBS patients, both when provided in person or online through an app option, which we'll talk about. So this does make this an evidence-based treatment option, whether you do this in person through a specialist and a provider, or if you do it online through an app like Mahana IBS, who is our sponsor of this episode. So Mahana IBS is FDA cleared. It is an app. It has some of that research on the online delivery of their program showing results for patients with IBS. And I believe it's 3 in 4 patients saw results and benefit, which you probably heard through the ads of this episode. And if not, maybe go back if you skipped over those, because there's some really great information in there, plus more details. But that is an option to receive therapy, is through that app, Mahana IBS. There is also the option to go through a GI psychologist, which we'll talk about in a moment as well, if you want to do more in-person therapy or another specialist provider in your area. Again, you do want to look for gut-directed CBT, not just general CBT, if you're looking for IBS-specific treatment from this approach. Another gut-brain therapy that's available is gut-directed hypnotherapy. So this is not a form of hypnotherapy that actually puts you in a state of hypnosis. There are levels of hypnotherapy that include hypnosis, but instead this induces a deep state of relaxation in order to guide you through a visualization that teaches your body to control gut function. So we thought of CBT as very much more action-oriented and an active therapy. Hypnotherapy is a little bit of a kind of deeper level nervous system type of therapy, like relaxation type of therapy. So with hypnotherapy, it's less active. It's definitely meant to be more subconscious. So there's a benefit in pairing both together, but also a way to think about yourself. If you're feeling a little bit paralyzed in your actions, hypnotherapy may actually be a great option because it is kind of happening beneath the surface a bit and doesn't take as much action from you beyond, working through the treatment and really, trying to get into that visualization and achieve that state of relaxation. But this can happen even subconscious, which is really cool. There is a thought that this can target the pain responsive regions of the brain, which again targets that hypersensitivity piece. And this can be provided through weekly sessions for 6 to 12 weeks. So there's a lot of different varying methods out there, but 12 weeks is used the most in different programs that are available. And there's, a lot of options. This has been around for a while. Studies do show that this can help reduce pain and bloating for those with IBS and improve quality of life. So a lot like CBT, there are definitely benefits that are seen, and it's shown to be a very effective therapy. And this can be done through a trained provider like a GI psychologist, ideally. Again, we'll talk about that in a moment of why that's so important, but there are other providers out there that can provide gut-directed hypnotherapy and provide you these sessions. They may follow a certain type of program. So you can ask, okay, what protocol are we following? There's different protocols out there. There are also some online programs that have been proven, studied, and are available to you. So one of them is a direct patient app called Nerva. Probably heard about them before, seen them out there. They provide a gut-directed hypnotherapy protocol that is shown to be very effective. This is cash-based, so you can buy it yourself and engage in it right away. There's also a prescription option that's FDA approved, kind of like Mahana IBS for CBT, but this is called Regulora. This is newer on the market, but maybe an option if you're looking at a lower cost option, trying to get this as a prescription and see if it's covered by your insurance by talking with your provider, that might be an option as well. And it's also been shown to be very effective, which led to the FDA approval for this as a treatment. And again, that's Regulora. So another option for gut-brain therapies is a personalized GI psych treatment approach. A GI psychologist is a subspecialty within psychology. So it's a trained psychologist first, but then they subspecialize in gastroenterology and GI in order to provide you with these gut-brain therapies. And what they typically will do is combine CBT, hypnotherapy, relaxation therapy, and even dynamic psychotherapy to personalize treatment to you as an individual. So if you are really struggling with online options, or maybe you're not seeing benefit from some of these online therapy options that are more isolated, you might see benefit from a more personalized approach from a GI psychologist, and that can be a really great option. GI psychologists are also really great at doing an assessment as a psychologist and pointing you in the right direction of the therapies that actually may be best for you, because there may be a role for treating trauma if that's actually what's going on, right? Based on complex histories. We are complex, dynamic individuals with histories that go beyond just our IBS, right? And so there may be something else going on, like trauma, that needs to be addressed by a different provider more thoroughly, or maybe an eating disorder that's present, or what we see with fear feeding disorder called RFID. That would need to be addressed differently and more personalized. And so they can help point you in the right direction of what's going to work best for you, and also support your gut-brain connection and what's going on with your symptoms from a GI psychology approach. So there's a lot of, again, personalization and value in this option, meeting one-to-one with the provider. The downside is that it is very difficult to find these providers because there's not a lot of them out there, and most of them are connected to bigger health systems. And so there can be a bit of a barrier, but you can go to gipsych.org to find a provider near you and use their directory. Also reaching out to other GI providers in your area to see if they have a connection or a recommendation to a GI psychologist, using Google well, searching for a GI psychologist near you, or that one that at least maybe even works virtually that can take your insurance or at least see you. Those can all be options to find a provider if that is what you are looking for. So to wrap up, gut-brain therapies do not mean that IBS is just in your head, or that you're just stressed, or that this is an anxiety disorder. That is not true. The gut-brain connection is very real, and it goes far beyond just being stressed or tense or anxious. There's a lot that can be involved in it, and IBS symptoms are directly connected to it. And so gut-brain therapies are just another option in your toolkit to target one of the drivers of IBS, which is the gut-brain connection, in order to see symptom relief and have better management. It may be a good fit for you. It may not be a good fit for you. That is for you and your personal healthcare team to decide. But hopefully now you have a little bit more information to go into those conversations with confidence, but also be able to really think through these options to determine what may be the best fit for you. There is zero shame or stigma in utilizing a gut-brain therapy. These are very effective and can just, again, they can really help. And so at the end of the day, we're all looking for relief, we're looking for support. And so it's something that is worth discussing more with your healthcare team and your trusted providers to see if it's right for you. I hope that was a helpful conversation. I would love to hear your thoughts or experience with some of these things if you have one. You can share on Instagram, on our Facebook community, in our membership if you're a member. All that information is found in show notes. We would love to have you in the membership if you're interested in getting even more support and more tools for nutrition and lifestyle changes that will help you manage your IBS. We would love to have you there, but would love to hear from you regardless. So thank you for sharing, and I will see you in next week's episode, where we're going to talk about why eating healthier might be making me feel worse. So I'm excited about that conversation and hope to see you there. Are you struggling with frustrating GI symptoms, gut issues, or maybe even IBS, and you really need support and guidance from a well-trained, qualified professional? If that is you, The Gutdirected team of dietitians may be exactly what you are looking for. We personalize every plan for our clients based on their assessment, their medical history, and what actually is working or not working in their body. We do this through close follow-ups every 2 to 3 weeks, all virtual. We also do weekly check-ins on every single client, and we are available for our clients through email and messaging support throughout the week and their entire program. Imagine this to be that hand-in-hand care that helps you reach your goals more efficiently, but also with more confidence and knowledge that you can use throughout the rest of your life. If that is what you are looking for, you can start with a consult call where we can talk a bit more about your history, what you're looking for, and what you need, and if we can help. You can find the link to schedule a consult call in the show notes if you are interested. We can't wait to talk to you, and we hope to work with you to help you reach your goals.